and also I know you're like super busy and like you're back to back with presentation.
Thank you very much. Also,
Yeah.
you help a lot.
Yes.
Our patients. Thank you very much.
Thank you. We love Nulook. I love you. I'm like a huge fan. I'm just like, oh my god, I love that Astri.
I'm also very happy because your therapy, so my patient is more easier. Actually, our concept is like Korean, but in Korea, they just go to surgery, they just go back their own. It's like they don't worry anything. Yeah, they just come. It's like going to hair salon.
Oh, really?
They come surgery, go home like that. Yeah, so
They
it's
don't
like
get nervous?
no,
No way.
no.
So it's just like English people who get nervous.
Yes. So when our concept to Australia, because they're very afraid, right, about this. And actually, in Korea, they're really like come by themselves and just go home by taxi. It's very easy for them. So actually, that's our concept. We just want to make patients thinking that surgery is not that scary as you think.
Yeah.
But normally, I think Australian people is not get used to it. So they,
I think
Yeah.
so. And I think I've noticed a lot of the clients are maybe a little bit older.
yeah,
I think sometimes their thinking is they worry too much or like they compare to something that's been in the media and they're like, oh my god, what's going to happen?
Yeah.
And I also, I don't know if you've noticed, for some reason a lot of people in Australia, they don't tell anybody. They do it alone.
Oh.
They don't tell their friends or their family. So I think sometimes they feel maybe like a little bit of shame or a bit of like guilt. Yeah, and then I think because they're then isolated, the worry is more. Yeah.
In Korea, they just tell everyone, I just do this so much. So I'm a little bit confused. Oh my god, what to do? And thankfully, you just come with your surgery, so it's much easier for us after surgery. You just cover.
Yeah. That must have been so confusing for you when everyone was just like, I'm so nervous.
Yeah.
Why? It's mine now. And we
Yeah.
have noticed that because we connect with them emotionally, we find that they heal and recover much faster.
Yeah, it's like it's okay, right? But they overthinking.
Overthinking.
Yeah, they're afraid. So
Yeah.
with us, actually, especially to me, they cannot talk that freely.
Maybe.
Yeah, but with the nurse, with your team, I think they can tell freely that, oh, I feel like this, I feel like that. And you're more comfortable.
Well, I've heard that Korea is the best in the world
Yeah.
for cosmetic surgery, so maybe the education is like higher.
Yeah.
So maybe when they have surgery, they're like, oh, this is just normal. This is like going to have, like you said, a dentist or my hair, whereas England, Australia, America is maybe a little bit different. I don't know.
They go to the surgery starting from 17, so they feel
Oh,
like,
yeah. That's 17.
yeah, so they feel like it's like normal things to do.
Wow, I didn't know that.
Yeah, it's very magical. Even they can do the surgery, like they come along, they do, let's say face, and then to the next day they do another part, and they just walking around with a bandage, they just walking around.
it's normal.
They don't even constant. They just like going away, and then people like for months we just like then they go.
It's so funny. I say with cosmetic surgery is like decorating your house. You cannot do just one room. You have to do one room. Obviously, you're Dr. Astri. You're a cosmetic plastic surgeon. You also own Nulook, is this correct?
Yeah.
And you're also known as Queen of Anti-Aging.
Not me. The stem cell is
The stem cell. My name is Karen. I am the marketing manager for Patient Concierge Services for anybody who doesn't know me. And this morning we had a fantastic presentation by Dr. Casey who flew in from Korea to educate us and teach us more about stem cell treatment. And there were so many things that I learned that I actually think I will have to watch the whole presentation again because there was so much detail. But in the meantime, we asked some of our members and our clients from Patient Concierge Services. We have a private Facebook group called STAR for surgical transformation and aesthetic rejuvenation. We told them last week about what you were going to do, and we were like, give us the questions to ask Dr. Astri. So we have some questions ready, so if it's okay with you, I'd like to go through them. So please bear with me, I do have paper because I don't know them off by heart. Robert has asked, what areas of the face and body can this process be applied in?
So as stem cell, actually you can apply in whole body.
Okay.
So as we were older, our hair becomes thinner, falling down, or your skin. Our skin is getting thinner the collagen is different. Even sometimes a lot of patients that after facelift, we always say that go for skin treatment because it can increase the results.
Okay.
Skin rejuvenation is very good. Neck rejuvenation, even your hands, and also it can be very good in the arthritis area. Your knee or any joint is very good impact for that area. Also, we can combine the treatment with other plastic surgery. Let's say with the fat transfer to the breast, to the buttocks, or to your face area. After you put fat transfer or fat grafting, it will be not 100% stay. Some is absorbed, some is stay. But with using the stem cell mixed with the fat transfer together, it can enhance the viability of the fat. Especially this one is not many people know, but it's very good for viability for the man, for erection, and for women for lubrication. So you can apply even until that area.
Okay.
For that one is that you are getting directly injected. But in case for internal organ, then for lung, for liver, you want the brain, you want rejuvenating, then you can inject it by intravenous. So actually, it's more to attempt or you can use it.
Or so if somebody had like a problem area, like you say, sore knees or sore ankles, you can do target treatment, or you can do through blood, and then that they will go to whatever part of the body needs the nourishment. Okay, amazing. Before I move on to the next question, one of the things that was discussed in the presentation this morning with Dr. Casey, he was saying the age between 40 and 60 he considered the golden age. So he was saying it's a really good period for, would you say slowing down the signs of aging?
Yeah.
Would you like to say a little bit more on that?
Okay, so actually why, first the stem cell is also expensive.
Okay.
Not all people can buy, can use it. So normally with productive age, it will start 40 to 50. They are more concerned with the health. Especially when you were young, like 20 to 30, we still very energetic, we have a lot of energy. Unless we're talking about normal people, not sick people. So actually 20 to 30 is okay if you don't get the stem cell injection or therapy. But starting to 30, actually our aging process is already started.
To grind.
Yeah,
Okay.
for the 40 and 50 is very important because that time when our reach is 40, our collagen, our cell is really going down faster compared to our 30. This is why we very need for the stem cell injection. So the stem cell is like, many people hope that what can I see after the stem cell. So what I can say that you will not see by your eye that time. You will not know, but you can compare your body with your friend later, 10 years later.
Okay.
You can check and compare you and your friend who haven't got the stem cell. The quality of life is different. Even we were aging, but if like our energy is staying with 40 people in the 40s, that is what we hope, right? We feel healthy in like 60 or 70 like that. So that's why we need the stem cell injection. And also, the earlier, like when you start to 40 compared to you start when you're 70, it's different. Because it's like slowing and reverse. So when 40, if you want to slow it and you reverse it, you can go to 30. But if you're already going to 70, yeah.
When I was looking at Dr. Casey presentation, I was thinking maybe he's like 46, and then when he's like, he was already 60.
Yes.
I was like, oh my god, well then that's perfect proof.
Yeah, and our CEO, he also got the injection regularly, and his energy is really different. We don't expect that he's like in 60, but he's like 30. He's even more healthy than me. Like more energy, more
vitality,
buoyancy.
Yeah, it's definitely intrigued me. I would definitely like to explore it. I'm 50 next year, and I have started to notice my energy getting less, and I'm close to menopause now, and I was like, oh, I wonder whether it would help with things like collagen, general vitality, and memory. I noticed my memory. I'm like, I wonder if it helps improve my memory. But it's good for overall health improvement.
Yes.
Okay, fantastic. So the next question is from a lady called Karen, and she says, it sounds very invasive. Is it the big step up from platelet-rich plasma, PRP, which uses the own patient's blood.
Okay, so it's different. So with PRP, it's only platelet-rich, but only plasma.
Oh, plasma. Okay, yes.
It doesn't have any cell. So from your blood, we take it out and inject it back. We just take the plasma to growth factor, to induce the growth factor from your own body. But with the stem cell, all people is still afraid that, oh, how is it invasive? But actually, if we take the stem cell from your own fat, it's only this very simple liposuction. We only take about 100 to 200 mils of your fat.
Yeah.
Doesn't make any difference in your shape.
Oh,
actually.
yeah. You only need a small.
Yeah, very, very small
Okay.
amount of the fat, and then we set it in our laboratory, and they will expand the numbers of the cell and inject it back like that. So it's not as invasive as we think. We should just cut and cut the injection. Actually, quite similar with the PRP application.
Okay.
Injection directly or to intravenous, but much better. So what the PRP do is we inject platelet plasma to increase the growth factor in that area.
Okay.
Only one if there is cell, let's say you only have 10 cells. So the PRP is only induced with 10 cells.
Yeah.
But if you injected the stem cell, you put the numbers. So from 10, you make it 1,000. You make it 1 billion. Yeah, so the working is different.
Okay, let's check I've got this right in my head. So let's say you decided to take some fat from my back,
Yes,
which would be quite, you just normally with local anesthetic to
Yeah.
extract the fat,
yeah.
and then you would send the fat away, extract the stem cells, multiply them,
Yes,
bring them back,
Yeah.
and then put them back into
yes,
the blood.
that's true. Only like that.
Oh,
Yeah.
that sounds really easy.
Yeah, invasive like that, no.
Yeah. And if it's something a little bit more targeted, like joint pain in the knees or the ankles, would you then inject to the
Yeah.
bone?
Yeah.
So that might be a little bit more painful.
Oh, actually no. Some patient also, it's just more like sore sensation,
Yeah.
only like 5 seconds.
Okay.
Yeah,
And will you do on the local or twilight?
local.
Okay.
Except patient very afraid. I don't want to feel anything, don't worry, we can make you sleep and then only
The
like,
option is to go on the twilight and the ring fat.
Yeah, only 1 to 2 minutes and finish.
Yeah. Oh, great. Next question is from Jasmine, and she said, I have heard of stem cell treatments is great for joint tissues such as arthritis, but would like to hear how it can be applied and utilised in the plastic surgery and aesthetic field.
So yeah, actually stem cells very known because many older patients have arthritis, and even injected today, actually the next day they already said, oh, very good.
Oh, really?
I don't have any pain anymore,
No,
so they addicted to them.
Oh, really?
Yeah, they really like it. Before, if you go to the orthopedic,
Oh, yeah.
they sometimes inject the steroid or hyaluronic acid, but this one is more better result and also longer than
Longer.
Yeah. But for the aesthetic field, actually it's quite similar. It's for rejuvenation.
Okay.
Reduce inflammation, rejuvenation, regeneration. So this one just changed from the knee, we just changed to your face,
Okay.
to your other body, to your head or other body area. But the purpose is same for the anti-aging, rejuvenation and regeneration to make your cell going back in the numbers.
I see. And I guess it would probably depend on your age,
Yes.
on how frequent you would need it.
Yes, that's true.
Okay.
For rejuvenation, especially in aesthetic area, for the skin, we targeted it can be reduced the pigmentation, can reduce the wrinkles, can give your skin more elasticity like that. But it's not like magic that you injected and everything is finished. No. But you need to combine with other treatments, yeah, to increase the even in Korea also they mix with the facelift. When they do the facelift, before they close it, they all inject the stem cell inside. So, because sometimes after facelift, people very thin skin or very saggy can take it a little bit, right? With the stem cell, before we close it and we inject it, it can increase the cells
Wow.
like that.
It's from Sherry at Bali Walks Medical Villas, and she says, are stem cell treatment only for existing issues or can they be used preventative? And if so, what other areas for early intervention preventative treatments would you recommend?
Okay, so for the preventive, we have, as we mentioned before, there is many kinds of stem cells. First is the MSC, the chromosomal stem cell. That one for prevention of course the anti-aging process. You don't know then where later you get sick and
Okay.
if just healthy people
Yeah.
just want to get it, that is the answer.
Yeah.
But if you want to increase the immunity, you want I don't want to get sick faster. That one we call NK cell. Yeah, this doesn't have any target for anti-aging, rejuvenation, nothing. Only for immunity.
Okay.
So if you want to enhance your immune, you do the NK cell. But if you want regeneration, rejuvenation, anti-aging, you choose the stem cell.
And also, do you have to have lipo first, or can stem cell treatments be harvested in another way?
Actually, there's another place from bone marrow, from
Bone marrow or fat?
or blood or your skin. But actually, the problem is the number.
Okay.
Fat is the most number we have, most volume we have compared to bone marrow, and also the number of cells is also a lot. So it's like easier if you take from bone marrow, you only get 1,000 cells actually. Normal, let's say 1,000, but from fat you can get it like 10,000. So when you go to the bank, to the lab, and make it multiply, it's faster and easier.
Wow.
Yeah, that's why we're using fat, and also because fat is not working, right? It's just a lazy thing from your body, but it's useless.
It works.
Yeah, they never work. So their cell is really good because it never works. So that's why we take from the fat and then using for the stem cell. But for the patient who doesn't want to, I don't want to use my arm, I don't want to take, I just want to go and inject it. We have another way with the Wharton jelly of the umbilical cord of the baby.
Okay.
So you just come and then inject it and finish. So no need to do the liposuction. Of course, we always suggest your arm is the best way. But if you don't want to, then you can use the umbilical cord.
Is there any side effects from using the umbilical
Same.
cord?
Same. Yes.
Okay.
For the umbilical cord, it's not from the baby. It's also not from the mother. It's in the middle, right? Yeah. So
Yeah.
actually, the immunity and rejection is very low.
Okay.
That's why the reason why they take from that area.
Yeah.
So until now, we don't have patients who have bad effect like allergy or something.
Okay.
Nothing. So it's very low.
Yeah.
So it's very safe to use.
Just while we're finishing off on that question, how long has stem cell treatment been going for? Is it like 20 years, 30 years?
It's already starting long time ago. Actually, the first time I forget what time it's from Japan.
Okay.
And you find it in Japan, but because it's still new, we cannot determine the exact result. So actually in medical, we have to have approval, like how many patients. But until now, the stem cell is really variated result.
Okay.
Some research say it's promising, it's okay. Some say, oh, it's not working, but very rarely they have bad effect. People like always looking for the last answer, like hope. When nothing can work anymore, then why not we try the stem cell? As long as not making any problem, any harm to our body.
But you've seen some good results.
Yeah. It's very good.
Yeah. Did you use it?
I definitely try to use it, but I only put it in my parents.
Okay. Oh,
My parents, I give them, and they feel really good in the skin quality.
that's amazing.
Yeah.
Did your parents use their own body fat?
Yes, their own body fat. Yeah, they use their own body fat and inject it there. So it's less like trial. Even we try to all people like the CEO of our company, all people we try, we just split and then we inject it.
Go to please.
Yeah, that's why I say that our neuro clinic, that DBI is our own actually.
Yes.
So we know everything.
You
We
have full control.
Yeah,
You have
full
statistics. You
control.
have the evidence. You know what you're doing.
Yeah, and we only test to our people by ourselves. So before injecting the patient, we always do it to ourselves.
Okay.
Check if everything is okay or not. Like
Yeah. Amazing. Thank you.
that.
So the next one is of Christy, and she says she has a sunken scar on her face. She's already had CO2 with subcision. It had 2 scar revisions and 1 fat transfer, but it's still noticeable. Should she have stem cell as well to improve
Yeah.
the treatment?
But we have to understand, scar is never 100% going back.
Okay.
Once that happens, maximum we can go back only to 70%.
Okay.
Yeah, so it will be no 100% healed. Stem cell is just the improvement. I don't think that just do the stem cell and everything's going normal. No, it has to combine. Use the T-cell, use the use the CO2 laser in the same day directly inject the stem cell. So the result is different. So in the healing process, we put number of cells there towards more. Yeah. Scar for right now, so many research using stem cell for the scar is really made good results.
Yeah. Okay, great. So if she has the CO2 and the stem cell, it will enhance the appearance.
Yeah.
Okay, fantastic. Patricia has said, it'd be great to understand step by step and timeline starting from the original consultation with Dr. Astri through to the complete recovery and follow-up maintenance.
Okay, yeah, of course, stem cell is very, people not many know it a lot. So if you want more explanation, you are always welcome here. We can arrange everything for you, from your coming, from your treatment, even after the treatment. For the recovery, actually, few hours and you just go back now. Yeah.
One last question from me is, if somebody has had cancer and they just had chemotherapy and they're now in the all clear zone, but obviously they're still a little bit fatigued and a little bit older, would this be a benefit to them to maybe boost some energy?
Yes.
Yeah.
But of course, if one is clearance, we will still inform to the patient. Actually, even you sure that it's not going to be any cancer, but still we don't know inside your body still have the cancer or not, because even at the PET scan still cannot detect very small our small cancer type. So with this one, some patients from the Korea, they inject this cancer for the recovery from the chemotherapy, and also some combined stem cell and also the NK cells together. Yeah, to induce the physically of the patient.
Yeah. Amazing. Thank you so much. Well, there are all the questions from everybody inside Star. Really appreciate your precious time.
Thank you very much for coming.
And if you need anybody else to practice on, I'm happy.
Okay.
Thank you so much.
Thank you very much.